Hi, Dr. Chism Buggs. I'm Becky.
Oh, well, hi there. It's nice to be able to put a face with the name also.
Yeah, same.
Wow. I thought you guys knew each other. That's too funny. That is too
Not
funny.
in person, so.
Not in person.
Yeah.
Yeah, we have people coming on. I'm just going to say welcome to everybody. You know, even though you're on mute, that's fine. I was just talking to the chancellor, so he'll hop on soon.
Okay, wonderful.
Well, I see the chancellor got his green Ivy Tech. That's a nice shirt, chancellor.
Yeah, it's a beauty. See, now I'm going to have to wash it before I wear it again tomorrow for press enrollment. Thanks for pointing that out, everybody. So we're still a little bit early here.
Yeah.
I hope everybody has a chance to get outside today. It looks like it's gorgeous out. I haven't been out there, but I think the high is supposed to be 80 degrees and it's supposed to be sunny.
Nice.
That'll be a nice full weekend.
Yeah. Okay, well, it's noon, and to respect everyone's schedules, I'd like to get started. I want to welcome you all to this call. Again, this is part of our ongoing Diversity, Equity, and Belonging series. And again, I think now is the perfect time for us to really double down and ensure that we continue the drumbeat of the importance of diversity, equity, and belonging, not just at South Bend-Elkhart campus, but in our community. And to that end, I just want to introduce Durana Bird, who's our Director of Diversity, Equity, and Belonging, and encourage her to work in outreach to all of you to again, continue this great effort. You know, I think we're at a turning point in our society to really make a significant difference. And again, what I hope is that Ivy Tech can lead the way for the South Bend-Elkhart region. So with that, I'll pass it over to you, Durana, to introduce today's session.
All right, thanks, Chancellor. We're really excited today about our first Friday. As you know, the talk is the real talk, mental awareness for minorities in the COVID-19 era. I want to introduce our facilitators today, both from Oaklawn Psychiatric Services. First, we have Dr. Larissa Chism Buggs. She's a psychiatrist, board certified in both adult and forensic specialties. She is a graduate of the University of Michigan, a BS in biology, and she earned her medical degree from Temple University School of Medicine. Through her clinical practice at Oaklawn Center and Hospital, she specializes in the treatment of mood disorders, women's concerns, including those associated with pregnancy, as well as the treatment of chronic and persistent mental illness. Through her forensic private practice, she is a court-appointed examiner for several Indiana counties. Dr. Chism Buggs is originally from South Bend and enjoys outdoor sports, theater, and spending time with her husband and family. So welcome, Dr. Chism Buggs. Then we have Becky Zakowski. She's an RN. She's the coordinator of SJC Cares, the system of care organization in St. Joseph County. System of Care strives to build meaningful partnerships with families, youth, and organizations in order to assist families in meeting the mental and emotional health needs of their children. Becky has been a member of the South Bend community for 20 years and spent her career in the fields of mental health and health education. Thank you so much for joining us today, Becky. And with that, we can have you guys go ahead and start your presentation. I think I remember from our discussions, Dr. Chism Buggs is going to kick us off. So welcome.
Sure. Thank you. And it's nice to be here with everyone here on Zoom. I thank you for the invitation. I also want to give the thanks to Oaklawn, who is supporting this venture as well by allowing Becky and I to co-host here. So this topic, mental health and minorities communities and how COVID-19 has impacted said community, is such an important one. As an African-American psychiatrist, someone who was from the area, I'm really happy to be talking about this because I think when we talk about things that impact our community, when we talk about those things that impact our world, but then discuss on a local level, I think we can begin having discussions about what we can do to make our community better. And so without further ado, I'll just go ahead and get started. You know, you can't really go anyplace right now, whether it be, you know, driving in your car, if you have the radio on, if you're sitting at home and you have the television on, you're going to hear some segment about the coronavirus. And it seems as though you really can't escape it. And that's another problem in and of itself. And I'll touch on that later. But just the scope of the issue is just such a large one, the magnitude of it, we really can't escape. And so, you know, how did we get here? If we think about where we are right now in August of 2020, last year this time, so many people were planning those last summer trips, what to do before the school year began, what to do just to plan the end of summer. But here we are in summer having very different thoughts, having very different concerns about, gosh, will the children go back to school? How will even adults who are in school, and here we're talking with a forum on Ivy Tech, how will classes be held? And will, if they open fully, will they remain open? So we have lots of questions, lots of unanswered variables that we may not actually have the answers to for some time yet. But how do we go forward? How did we get here where right now in America, 160,000 people have died from the coronavirus? Locally, about 3,000. And those are staggering numbers. We haven't seen something like this before since the pandemic of flu in the past. But in the midst of those large numbers, in the midst of those uncertainties, there is another story, and that's really how the coronavirus is impacting minority communities. But I should back up and say this. I mean, clearly we've all heard of the coronavirus, this novel coronavirus. Our bodies have seen coronaviruses, just not of this type. Coronavirus is actually the kind of virus that causes the common cold. Clearly the coronavirus, the novel one, is something much different than that. And so that's in part why it's called novel, the novel coronavirus. And it was identified by the World Health Organization in 2019. So that's where we get this sort of COVID-19 name from. And we know now, having heard it so many times before, that it is it's airborne. It's spread through droplets in the air, whether when someone coughs or sneezes, exhales. And we've heard even, you know, gathering together and maybe someone is singing and the spray from our mouths, from our lungs goes further. We can spread the coronavirus in that way. And so local, state governments, national efforts have been made to try to reduce spread, in part through mask wearing. Some of us have never probably imagined needing to go outside and wear masks. Social distancing, staying 6 feet apart, because that's the distance that's thought to perhaps be to put people less at risk from spreading the disease from one person to the next. And so with all those things being considered and having to think so much about how it is we go out, when we go out, what to do, should we touch things when we go out? Should we touch other people? Should other people touch us? We're having so many new things to think about, things that we really haven't considered. In the midst of all the things we still have to do, it really does weigh heavy on the mind. And, you know, I said, how did we get here? And I said, there's another story in all the numbers. And that's, again, how the coronavirus has impacted minority communities. And so I wanted to show a couple of slides, and I think I have the ability to share my screen, because I think there's some pictures sometimes speak louder than words. And I have a couple of neat pictures that will help illustrate some points I want to make. One second. Okay. So let me see if I can open this one. The initial picture I wanted to open didn't open, but can you see this slide, this bar graph? Can everyone see that?
You may have to unshare and share again because unfortunately we do not see that up.
Okay. All right. Do you see it this time?
Yes.
Yes,
Okay,
ma'am.
wonderful.
Yeah.
Great. And so this particular screen is taken from the CDC. You can see that in some places, in some counties where there has been a tracking of the number of residents living in an area that has been tracked, you can see the people hospitalized, the percentage of people hospitalized with the coronavirus. And here, non-Hispanic white, 59%. It doesn't tell me exactly where these counties are, but you can see that 45% by comparison, non-Hispanic white, have been hospitalized. So in populations where there's still that tracking going on, if we look over non-Hispanic Black, in terms of those people living in the county that fit that demographic, smaller percentage, but a greater number have been hospitalized. And I think that just illustrates the point that in communities where coronavirus numbers can be tracked, there is a disproportionate number of African Americans, minority people being hospitalized with the illness. And they're also facing the most serious sequelae or consequences from the illness. There are also larger number of deaths proportionately. And that's a concern. Now, health disparities is not a new thing. It's not a new topic of discussion, and I'll talk more about that in a moment. But what this has highlighted is an issue of access to care. It also has highlighted some outcomes from that access to care, such as hypertension, diabetes, underlying pulmonary conditions, putting people greater at risk for contracting the coronavirus, but also doing less well when they do. And so with greater propensity towards diabetes, hypertension, obesity in minority communities, particularly African American communities, you have this sort of, they have this conundrum, this double whammy going on, because you have an illness that we don't have control of, that's spread through droplet or airborne means, that is affecting minority communities disproportionately. And unfortunately, because of our country's history, there are some other issues, some other social determinants of health that play into this. And so that's issues like housing insecurity, or just unfair or unequal housing opportunities, such that some people living in smaller or more close-knit quarters, you don't really have the ability to social distance, as though you might try. You have other economic issues. There are a greater proportion of minorities, African Americans, are going to have these so-called essential jobs, these essential workplace positions that also don't allow the same opportunities for maybe working remotely to create even greater than a 6 feet of separation or distance. And certainly maybe not even having the ability to take the time off. So that leads to job insecurity, income insecurity. And that in and of itself is a stressor. And we know, just it's common knowledge, that when you're in a stress situation, when your body is stressed, perhaps even chronically, you're at greater risk for developing illness of all sorts, but certainly mental illness as well. And so in looking at this slide, I've talked about the hospitalization disparities, but I want to show you something else, and I will do another screen share. And so I will again ask if you're able to see this other slide once I get to it. Can you see this slide? This one is.
Unfortunately, we need to unshare and share again.
And share again because it's the same slide.
Okay, I'm so sorry about that.
And that's okay. And while you're doing that, I do want to say to anyone that at any time, if you would like to put questions into the chat, we are monitoring the chat as well.
Okay, is that a different slide?
We don't see it. We just kind of see your screen where you have like 3 or 6 things up.
Let's see. Well, I won't belabor the point then if it doesn't really pop up and share. I'll stop sharing. But that was something from the city of South Bend sponsored a study some years ago, and it was from Prosperity Now. And what it did, it looked at some income disparities, educational disparities. It looked at poverty levels in South Bend and compared its Black citizens to white citizens. So if you have a chance to look at the Prosperity Now document from 2017, it's interesting because it just highlights in picture form. It has some words and some other data points there, but it highlights in picture form exactly what it is that I'm trying to communicate. And I'm sorry that I wasn't able to share that. I have to work on my Zoom sharing skills, I suppose. But in those truths of housing, income, financial, educational disparities, this stress is present. And so that's a very real stress, and it was a real stress even before the coronavirus pandemic began. But this has exacerbated, it's heightened so much of the stress that exists and has existed in minority communities. And then in the midst of this, we have issues in our society that we're still dealing with. We had the death of Eric Logan locally, and nationally, our country has been reeling and grappling with the death of George Floyd. And so as we're trying to figure out ways to stay healthy, we're also trying to figure out ways in which we can work with one another, talk with one another, communicate better with one another, despite multiple barriers. And so, you know, as we think about access to care, especially mental health care, and that will be the large part of my focus going forward as a psychiatrist, I just want to point out a few things, because clearly you can see the trajectory of the course of events that I'm trying to build here. There's so many things that we're thinking about, so many different variables we're trying to juggle, and how heavy and weighted the situation is. I hear it all the time from the patients that I see, and even those people with whom I discuss this issue within passing. It's just a heaviness. I think even Michelle Obama had a podcast recently that talked about feeling just too low. So there's this global sense of heaviness. And so you're dealing with stress, which creates a predisposition for some difficulties to emerge, depression being one of them. We know as psychiatrists that depression is a global cause of disability in the United States, with about 300 million people in the United States. About 13% of them identify as African American, and about 16% have some form of diagnosable mental illness. Now, that's not a small number. That's millions of people. But I can tell you in my practice, by and large, the percentage of African American patients I have as compared to others is smaller. And it's not because African Americans don't get stressed. Clearly we do. Don't get depressed. Clearly we do. Don't commit suicide. Certainly it happens. But it tells me that we present differently. And sometimes we're not presenting at all. And there are studies and statistics that point that out. And compared to our white counterparts, Black people present to psychiatrists or seek out mental health care services of any type almost half as much as white people. And so whereas 40% of white Americans might seek out mental health services, about 20 to 25% of Black people will. And so what that means is when we do present, when we do come in, we might have been sicker for longer. We might have been suffering silently with more physical and other medical comorbidities as a result, because as I mentioned, stress creates issue, creates problems, promotes illness, and then have less means to be able to deal with it. Maybe we don't have the time to take off or come in to get appointments. And if we do take off, heaven forbid, we may not be sure that the job security that we hope for is still there. And so in thinking about depression, I think it's really important to talk a little bit about what that is. Sometimes there's so much misconception about mental illness. You know, people think that you have to be some sort of caricature of a mentally ill person. A mental illness, it knows no, it's not a respecter of persons, but there are some features, some symptoms of depression that are fairly universal. Certainly that everyone won't present 100% the same, but things like, in addition to sadness, the depression is much more than simply feeling blue or feeling down. This is it's a series, a set of symptoms that are going to persist for at least 2 weeks, but usually longer. That might be in addition to low mood. You might have your sleep affected. Maybe you won't sleep very well at all, but maybe you sleep too much. It might affect your appetite. Maybe you feel like you don't want to eat and lose weight, a significant amount. Or maybe you're eating too much and the opposite happens, you're gaining a lot of weight. Maybe you can't focus, you can't think, you can't concentrate. And certainly those can have an impact on the way you function at home, at work, or even in your interpersonal relationships. You may even feel guilt, an excessive sense of responsibility or duty over things that you've done or that you shouldn't have done. Either can be the case. You may even have suicidal thoughts. And certainly that's the worst outcome with depression, when someone acts on suicidal thoughts and completes suicide. Suicide is the 10th leading cause of death overall. It's the second leading cause for those 15 to 24. And so if you think about this sort of heavy situation that we're facing, and then we're distancing from one another, it's important not only to normalize these conversations about, you know, what is depression now that we kind of know what it is and what symptoms to look for, but even in the midst of distancing, trying to figure out a way to stay connected. Even in forums like this, I think this is so important because it allows people to communicate. Even a lot of addiction groups and circles are moving to some online forums because people are struggling being distant from one another and not having those familiar social contacts and being able to discuss things in a familiar social context. And so even learning here at Ivy Tech, I'm again glad that you have this forum, this Zoom forum in this fashion, because many times learning is multidimensional and it takes new and creative approaches to learning through Zoom. Certainly it can be done, but it is not necessarily it's not necessarily the norm. People aren't used to not being able to share something, and clearly I'm not used to being able to share things. I couldn't share my other diagram, but people aren't being able to communicate and share things much in a familiar way. So that's can be a source of frustration as well as we work towards these processes of new learning. And so, going back to that topic of depression and how that can work into the impact that the coronavirus is having on minority communities. Again, I don't want to belabor the point, but I don't think it can be said too much. A lot of those social determinants, housing, economic, education, financial resources and wherewithal. When you're depressed and something has been going for a long time, you can feel heavy, and then you have the weight of this new issue, the coronavirus, weighing on you, and you still have all the same stuff that you've had to deal with: family responsibilities, obligations to children, spouse, work, and maybe because of the way things are right now, you don't have a full-time job. Maybe you have 2 part-time jobs and you don't have health benefits. Something else that's impacting minority communities in a much greater degree. So maybe you're reluctant to go seek the help that maybe you are aware that you need it, but my gosh, I can't afford it. And I already have all of these other bills and obligations to do. And sometimes mental health issues and concerns are put on the back burner because of that, because it's not something that is as tangible by and large as other things. There's not necessarily a reading you can take, like your blood pressure, that gives you a systolic, a top number, and a diastolic, a bottom number. But the gauge is more of an internal, interpersonal one. People can really be suffering and no one even really know it. I mean, how many times have you heard someone say after a completed suicide, they never saw that coming? Or we didn't know that, you know, so-and-so was really having such a difficult time, which is again why forums like this are so important, to begin to have discussions about illness, normalize those discussions, and then maybe have some things that we can do to make sure that we have some good structure in place for intervention. And so when I said I wanted to go back to access to healthcare, and I talked about insurance. And so as a psychiatrist, I mentioned I'm from South Bend. Clearly, I'm an African-American psychiatrist. There are not a lot of African-American psychiatrists in the Midwest. Absent Chicago, you can find more of us there. But by and large, the numbers of minority psychiatrists, even and therapists as well, are smaller. And so in terms of just that cultural competency piece, maybe someone has a question that they would like to be able to ask someone who has some kind of similar shared experience, background, or culture that as they do, if that's going to be a challenge. And because of that, there exists some historical mistrust in the African-American community. It's not so long ago that something, the Tuskegee experiment happened. And you know, you hear about such things and you think that it was, gosh, eons ago, something that happened way back when, before there were paved streets. But you know, you think about people seeking treatment, African Americans seeking treatment for syphilis and being told they're given a treatment, but not given that treatment actually. So the effects of advanced stage or tertiary syphilis can be observed. And that resonates. I think there's a cultural memory there that creates some issue and concerns. I don't know how many times that I hear as a curbside from Black people that, you know, I wouldn't want to go see a psychiatrist because, you know, they're just going to experiment on me, give me some medicine that's going to make me worse, or not give me the real medicine that I need. I'll just work through it. And the working through it, sometimes depression has a natural course, and for some people it can end, but many times depression is persistent. It can be pervasive, and once you have one episode of depression, you're by and large you're increased likely to have another. And so that's a very real reality that many people struggle with it many times alone. As I mentioned, African Americans present and come in later stages of illness having struggled for much longer. And so that's just the personal piece of it. But if we think about that person belonging to a system, and that system being the family, what happens in the family as well? So, you know, depression might make you energetic. You might not have the energy or motivation to do the same things that you've always done, even though maybe you're pushing through it. You're trying as best as you can to do things as you always have been, but it's gotten really hard. And so depression might make you less sensitive or focused on those things that might promote health and well-being, because maybe you just don't have the energy to put into it. And so here we are with all of these other things to do, and sometimes depression can make even the smallest extra thing seem so much larger because you feel so weighted. So you might have situations, and conceivably it's easy to see, where, gosh, you know, it's too much to wear the mask. I'm not going to do that. Or all this hand washing, it's just too much. I'm going to pray that it's going to be okay. And so if you have that happening, an already stressed individual, an already stressed family system, you can see just how this sort of snowballs and what the trajectory of that course might be. One person could be, unfortunately, putting other people in the household at risk, especially if they're living in a household with several people having an essential job that forces them to have to go out into the workforce, and they're just not cognitively having enough or sufficient energy to sustain attention to all the things that we might have to do. And so depression is something so real, and I haven't seen any numbers just about distinctions in terms of, approaches or access to care that are different now as compared to maybe last year for minority populations specifically. But I'm sure those numbers are going to be coming out, because by and large, people are seeking more mental health services. But historically, that trend has been there. We're still doing it, more slowly. And
Dr. Chism Buggs, I have a question.
yes.
And it's pertaining to kind of what you said earlier. It is it says, what should I do if I cannot stop worrying? So is everything that's going on and things that you talked about, what advice would you have if I can't stop worrying?
Well, worry is tough right now. Not an impossibility to deal with, but it's tough because there's so many new variables. You've heard me, highlight a few different things. And for whoever raised that question, maybe there's some other personal things that, are contributing to the pot of worry as well, and then how to juggle them. And so worry is not necessarily it's not a good thing when it takes our attention and energy away from the other things we should be doing, but it may be just sort of that energy put towards the things that have to be addressed, but we have to figure out some constructive ways to address it. So that worry, just the sort of repeated thoughts about things that maybe we can't really control right now, doesn't become anxiety, becoming a physical response to the worry. And so if you can't stop worrying, sometimes something that is effective is really compartmentalizing, the things that I can do right now that I actually can manage versus the things that maybe I can't address right now and that I have no control over. And maybe trying your best, if it's something that can be separated, just separate those out and see if those things that you can't control or address right now are the kinds of things that maybe you can enlist the help of someone else to address. And if it's not something that you can address by enlisting the help of a friend or another peer group, maybe it's the kind of thing for which you might want to seek some professional help and advice. And that's the work of therapy, really. Therapy is different than life coaching. Life coaching, by and large, this is really a nutshell. So for anyone who's a life coach, I don't want to condense what you do into this nutshell of a comment, but it's sort of guiding someone to make different decisions. Therapy is more sort of an uncovering how we understand what we do, how we understand how we feel, and how we maybe be able to process those things in a new way such that we're not stuck in a pattern of worry, because worry can be immobilizing. Especially if we don't figure out that we can actually change the pattern of the course of our responses to it. So I hope that was helpful. And if there's another follow-up question to that, certainly I can add to what I said.
Well, I have another question, and it is, I'm feeling, they wrote it as, I'm feeling lonely, I'm isolated, I'm at home. Is there anything or any tips that can be done to help me get through that feeling?
Sure. Being alone or feeling lonely and being at home. Yes. Now, it may not necessarily be going out and being in the midst of several other people, but if there are other people in the household with whom you live who are exposed to, by and large, similar breathing spaces, there may be some creative things that you all can do as a unit to get outdoors. Maybe, take a walk. And even I've seen people in my own neighborhood taking some social distance walk where you see people walking in tandem 6 feet apart, because what happens in the fresh air, it kind of blows past you and you're not necessarily at the same kind of risk of exposure if you're separated, but then you're getting out and you're getting some vitamin D, you're getting some sunlight and fresh air. And so those things might be helpful. But if, say, you're not able to get out and walk, again, what is really neat about this time, believe it or not, is the ability to access forums like this and to stream things online, to Zoom and FaceTime if you have a smartphone. And I know another issue is, technology disparities. Not everyone has the same access to technology right now. And so that is a bit of a challenge for that segment of the population. What can we do? And so it might be left to more physical things, getting out, social distancing while doing so. But using the platforms that do exist even more so. I know I probably haven't been on Zoom so much in all my life, or used my FaceTime in all my life, but I'm using it more to stay connected to people that I can't be physically close to.
Thank you.
Mm-hmm.
Those are all the questions I have right now. I don't know. Oh wait.
Yep.
I have a comment here. The worrying, my therapist told me to consider what the issues are. Are the worries realistic? If yes, how would I deal if it came to pass?
So basically, something I'm worried about that in the midst of my worry, I don't know if it's going to happen. I'm worried that it might, but then it does. How do I deal with that? Okay. And so I think the challenge with that is this sort of anticipatory worry. We're worrying about things that might happen. And by and large, among all things that are possible, certainly it's going to be the case that something you're worried about, by and large, statistically speaking, will happen at some point. And so that doesn't mean that you are justified in the worry. I mean, the worry typically, and by and large, doesn't really help us navigate better through our life. It really more so is incapacitating and immobilizing. And so simply because something comes to pass doesn't mean that you should thereby worry about it. So I think if you look at it in sort of a retrospective way, looking back from the point of something being realistic, okay, that's fine. What could I have done with my worry to prevent this reality from happening? Likely nothing. And so instead of worrying about it, what could I do differently to occupy my time, to exercise different choices, knowing that my worry did nothing to prevent this outcome? And so that may be helpful. And finding things to do can be a challenge. And so maybe, you know, worry is present, maybe depression is present, and maybe you don't have the energy to be on Zoom or on FaceTime, and you don't necessarily want to have that one-on-one. Maybe you're feeling distant. Depending on the whole set of variables, if someone is doing a little bit better, spending some time alone, being self-reflective, reading, poetry, music, aromatherapy, bubble baths, hot showers are all things that can be forms of self-soothing and can be quite effective. But I do not want to leave that comment suggesting that being alone is better, especially during times when there's already so much distance. It's really important to have some sort of connection, whether it be to a single person, to groups of people, or to other communities. I can't underscore enough how important it is to stay connected and be a part of community right now.
Thank you.
Other questions? Well, if not, you can chime in and let me know if other questions should emerge. I'll move forward, and I also want to leave time for Becky to speak as well. You know, I've been talking clearly about our healthcare system, and I want to also say something more about it. As a psychiatrist, there have been some issues of concern. I don't know how many of you have ever heard of Benjamin Rush. Benjamin Rush is someone credited as being the father of American psychiatry. Benjamin Rush was the dean of the University of Pennsylvania, University of Pennsylvania. He lived in the 1700s. He was an abolitionist. He really wanted to do and did do some very positive things to advance the cause of freedom. But at the same time, oddly enough, he also had a very widely publicized paper during his lifetime called Negritude. And his thought was that the plight of Black people was that they were not white. And so I only bring that up to talk about some structures of discrimination, structures of racism that have existed in medicine. It's not something new. And I'm not saying there are providers out there in droves who operate in such an implicit place of bias and prejudice, or even racism. But there are. But I bring that up to talk about some issues that you've probably heard about, that I've heard about, where people are kind of saying, well, it's not that the coronavirus is causing such impact to minority communities. It's sort of the minorities themselves. You know, they're part of the issue. They're not exercising, they're not dieting, they're not taking care of themselves. And this sort of this shift of blame to say that, you know, you need to do something different or be different to be better is also a problem. And I think in terms of what physicians can do, what the community can do, is be aware that inherent structural problems and racism can exist in systems of care that are designed to help. And I know that's probably not a new discussion, but I think, again, the coronavirus has highlighted some of these concerns that have been historically present for a long time. Just they look different. We might call them different names, but the problems are still there, and they impact the care and approach to care that some might encounter when they come through the doors. And so in terms of, you know, cultural competency is a whole nother talk and lecture, but it's partly looking at how we think about things, how we feel about things, what shapes our opinions about things, and what shapes our responses to other people, being informed about our past experiences. Having those discussions, which can be very difficult at times, I think can help make a safer and healthier community, whether that be the community of Ivy Tech, whether that be the medical community, or any other community or group that each of us might belong to. And so just really being introspective and being able to discuss maybe some of those maybe not so pleasant things that we might encounter just by nature of kind of looking inside ourselves. And so I just wanted to kind of add that comment as well. Other questions?
I don't have any at this time. And so that seemed like you talked about the system of care was a great segue to Becky. That was awesome.
Yes. And you're on it, Dorana, you're on it. So Becky, I'll turn it over to you.
Hey, thank you. Thanks, Dr. Chism Buggs. I really appreciated hearing your presentation, and I know I definitely learned a lot. So just want to tell you a little bit about system of care. You may hear of system of care as kind of a descriptive term, but what I do in St. Joe County with SJC Cares, that is our system of care organization. And Dorana mentioned this in the introduction, that a lot of what system of care is focused on is, it's kind of, in my interpretation, I've been doing this work for about 3 years now, specifically system of care, and it's in a lot of ways, it's the mental health system recognizing that a system operates a certain way, and system of care sometimes is putting kind of this nimble human layer in there. So we do have a consortium in our community called SJC Cares that meets monthly, and right now we have about 55 people attend. Our meetings are on Zoom. It's a pretty informal group. Many of the people who attend kind of for professional reasons, because they are in a position that somehow that serves families or young people. But we also have community members who are just kind of like stakeholders, and parents attend also. A lot of what we do there is information sharing, because a big kind of part of the system of care philosophy is believing that that experience for families and the experience for youth when they seek mental health services and supports will be better when they're like through relationships. And so not just the relationship a person has with the provider, but relationships among different providers. And we talk a lot, terminology I've learned since doing this job is formal and informal supports. And I think that's really pertinent to what Dr. Chism Buggs has been sharing too, that while for mental health concerns, while it's important that the people are aware of the resources we have, and that, you know, there are counseling services available. Oaklawn's our community mental health center, which will serve everybody regardless of their ability to pay. We also have a lot of, private counseling organizations in St. Joe County as well, and some additional community mental health centers. But there are also informal supports. And one way we can look at that, when we look at SJC Cares, is, gosh, organizations that somehow help contribute to resilience. Organizations that somehow can be a piece of what Dr. Chism Buggs was talking about with, not being isolated. And so again, we have extra challenges right now, and a lot, like our SJC Cares meetings are virtual. They're very similar to what we're doing now. We always spend time in breakout rooms, but informal supports might be, an example that comes to mind is Boys and Girls Club. There's a group in town called Transformation Ministries. There are after school programs, community centers. Those are the types of organizations that come to mind, although it's not limited to those organizations. We talk about informal support. So SJC Cares is a network of those. It is true that I'm housed at Oaklawn, and I don't work. I'm actually paid by Department of Mental Health and Addiction in the state of Indiana, and Oaklawn is a great grant agent. So I'm not really an Oaklawn representative, and I don't only refer people for Oaklawn services. Our focus is child and adolescent care, and families. Recognize that among the Ivy Tech population, we're talking families, many of the faculty and staff have children, and many of the students you have children too. And we certainly are interested in supporting adults in that too. So I guess I've come to realize when we talk about family support, that's a really, really broad umbrella. I'll see, I've never done well with screen sharing. I'm going to try, because we had recently put together a resource sheet for SJC Cares, because we had, oh boy, I have a lot of things on my screen. I can't see what I will pull it up in a minute. But we have done a training for people who in the community to learn how to report child abuse. Kind of child abuse reporting 101 that we collaborated with Department of Child Services on. And for that, we put together a resource sheet, which we call the St. Joe County Blue Sheet. A lot of the resources on that sheet are kind of youth specific, but it does have system of care. And the nice thing again about system of care, we're small and nimble. And so sometimes it's just being able to talk to a person. I do want to say, when people are seeking mental health support in the community, Oaklawn is a great place to start. And our Oaklawn Access Center does not only refer people to Oaklawn for services. They're very good at their job. There are many different considerations that they have. They will listen to somebody. Sometimes if there is a wait list at Oaklawn, they may refer people to services elsewhere in the community, suggested places that they call. But again, where system of care comes in is having those relationships between these different organizations, so where people can make referrals easily. So the Oaklawn Access Center is always a great place to start. Another thing that we have on the blue sheet is many different crisis lines. And so there's some national crisis lines. We also have some local crisis lines, or crisis lines that are specific to the state of Indiana. And so Durana, I know it was kind of a last minute email. We're talking about, there might be some ways, we don't really have registration for who attended today, but I can definitely get some of those physical copies of that sheet to Durana to have at Ivy Tech for people who'd be interested. Because a lot of, again, what we try to do with SJC Cares is get resources in the hands of people, and also help people access those resources. So if somebody maybe didn't know where to begin. Now, I am not a mental health professional. I have an RN license. I've done a lot of different things. But what I can do is listen to somebody, share ideas, listen to ideas, and perhaps make suggestions. And again, the benefit of what I do with SJC Cares is in St. Joe County, I'm fortunate to be able to know a lot of people. So I like to help people get their questions answered. And again, while some of what we do with SJC Cares is structured, I'm also somebody people can just call if they don't know where to start and they have questions. And again, it's really just kind of that human touch. Another thing I want to share is that we do have we offer something called parent cafes, which are an opportunity for anyone raising kids. And so grandparents raising kids, and the kids can be anywhere from 0 to young adult, can get together with others, and they're organized around protective factors, but it's a time to have open discussion. We also have parent cafes, new parent cafes we're starting to offer, which are called a More Perfect Union parent cafes. The template was developed by a group called Be Strong Families in the Chicago region. But these are specific parent cafe questions that are dedicated to social justice topics. So again, back to what Dr. Chism Buggs mentioned about how it's important that we have conversations about these things. The nice thing about parent cafes is that they offer a safe space for people. We can do a parent cafe for a church group. We can do a parent cafe. They're not expensive at all. We basically do them free of charge. We could do them for, you know, a group at Ivy Tech, but we also offer them just to the general public. And it's, as a parent myself, and as somebody who's participated in parent cafes, I'll say I find them remarkably cathartic, that sometimes, again, just that support from total strangers, just a safe space where you can share your ideas in a place where it's not a place we go for advice. It's a place where people support one another around open-ended conversations. And they usually last 90 minutes to 2 hours. So that is something, we have that information on our sjccares.org website, and also on the blue sheet, which I haven't been able to pull up, but I think that's my fault. It's not Zoom, it's Becky. So again, I'm informal. Another thing that we are doing with SJC Cares, so our consortium meets the second Tuesday of the month. I will put my email address in the chat here, and if anybody is just interested in being part of our email group, there's no obligation to come to meetings. We have, again, about 260 people receive the emails, and the average meeting attendance is 55. So you would get information about that. The consortium meetings are open to everybody. They're the second Tuesday of the month at 8:30 in the morning over Zoom. So we have one this coming Tuesday, August 11th. And we are starting a new work group. I don't know exactly the name of the work group, but it is dedicated to diversity and inclusion. And a lot of what we'll be striving for is having this group of people on the committee who will help the systems that serve youth and families grow in their cultural competency. So again, that group needs to be determining, we'll be setting goals and things, but and it just hasn't begun to meet yet. We're sharing that at Tuesday's meeting, so if anybody has an interest in learning more about that too, you can contact me through email. And the other thing that I wanted to share, I think I can share this one, so let me try the screen share again, is one of our members in SJC Cares is Seasons Counseling Center, and I know you are familiar with Seasons at Ivy Tech, and the Pod 7 program. And so one thing, I had reached out to Allie Sobieski, the director of Seasons, to let her know we have this presentation today. And, okay, are you seeing that on the screen?
Yes, we see that.
Okay, very good. So one thing to be aware of now is that the service for Ivy Tech students is available virtually. So they're offering telehealth, and students at Ivy Tech can connect to counseling services without leaving their home. So that is accessible through that. So that is support that is available to the Ivy Tech community. And again, these flyers will also be available. I'll work with Dorana on how we can make sure that that information is shared throughout Ivy Tech.
So in order to access this service, do the students need to come with their student numbers, or how do you vet them to say, yep, you're part of the Ivy Tech community?
Allie was on the call earlier, and she had to go because of her daughter. But
yeah, I'll work with Sandra on our side and make sure we have that clearly defined. Thank you.
Yeah, I'm sorry, I don't know the specifics of that.
Yeah, Dr. Balkin, the students, they is referred. It starts through the pod, and
okay.
Then they actually the confirmation is done, and they're good to go. So yeah, it
okay.
starts through the pod.
Yeah, that's great.
Okay. So just wanted to, again, kind of reinforce that is available as support for students. Another thing that just anecdotally I've heard is like telehealth, not all counseling services in the community are exclusively being offered through telehealth, but it was amazing to see, just like it was amazing to see the community as a whole, just that whole transition to Zoom and other electronic ways of communicating, it was amazing to see how quickly providers were able to respond to the need to be able to see patients virtually. Some places are still are seeing people face to face for therapeutic services. There's a variety of considerations in that. But I also know that specifically I can speak to child and adolescent services that there are times where there is quite a wait list for people to be able to access services at Oaklawn. And currently that is not the case. And so they are accepting new families, new patients, new children into the system right now. And in some cases that even same day service, which, you know, talking about everything that's changed since last August, that would not have been the case last August. And so that is, again, something that's just important people are aware of. So if they're considering getting help. And then once they enter into the system, there are multiple different services that would be made available to their children.
So can I ask a question? You know, and I know this is such a huge topic and such an important topic. I feel like we'll never be able to do it justice. But, you know, one of the concerns we have as a campus, as part of Ivy Tech Community College, is ensuring that we're providing the services our students need and the level of support that, you know, is commensurate with the demand. And hopefully, you know, greater service than is required at times. And, you know, having heard yesterday that Michelle Obama on her podcast shared the fact that, you know, even she is feeling like she's got low-grade depression or, you know, a feeling of malaise because of all the churn. You know, I know that we probably all are experiencing that, but for people that have a cultural memory issue, you know, and having been, you know, treated poorly, you know, victims of social injustice, are there things that we should be putting in place for, you know, regular communications or regular chat sessions for our students and faculty, you know, just to enable this ourselves? Or, you know, does it make better sense to tie in with this, you know, this 90-minute SJC Cares organization? Or, you know, I'm just trying to figure out how best to enable support at the campus level.
Do you mind if I chime in and address that?
No, please.
So I think there's no unilateral best approach, really, because what's going to work for one person may not work for the next. But I can say having a forum for discussion, whether it be like this or whether it be something to participate in through SJ Cares or through seasons or through whatever services that might exist or student groups at Ivy Tech, having someone just have the opportunity to come and voice their feelings and thoughts is powerful. So I think just having access to that release, so there's not such a sort of a visceral holding in of pain and difficulty, goes a long way.
So one of our challenges as a community college, it being that we have traditional and non-traditional students, is that our persistence rates are typically 30 points below a four-year university. And to that end, you know, I think oftentimes students are obviously in a position where life gets in the way. You know, you hear that all the time from community college students. But we're really interested in trying to figure out how to help them have greater grit. And, you know, this idea of, you know, demonstrate that you can overcome adversity, you know, reach out, you know, touch somebody and make sure that you're at least getting advice on whether or not stopping out or dropping out is the only option. Do you have any thoughts on what we can do? Because what I'm concerned is that, you know, the norm now is going to be this feeling of malaise that is going to just potentially, you know, have a greater impact on students stopping out or dropping out, because it can be overwhelming at times. And, you know, what's the new normal on how people might feel on the day-to-day is probably not as upbeat as it's historically been. And we've historically had a problem, right? So, you know, any thoughts you have on that would be greatly appreciated also.
I think my comments are really going to be extension of the ones I just made. They're similar because I think there is not going to be a singular solution of sort of a panacea to the problem of attrition for community college. But I will tell you, communities are important. If you think about the civil rights movement and what was effective, it was because people had community. There was solidarity. They had voices that mattered, and people were listening to them. So whether that happens in a forum like this or someplace else, I think just having a forum where people feel they're a part of a community that cares about what they're thinking and feeling and they're not alone goes a long way.
Great. Thank you.
I agree. And I would be really happy at some point to share with you just kind of the cafe model, to do maybe like a little mini cafe, because what we hear about that, and again, I don't think that's the solution, but it might be a piece. It might be something that Ivy Tech could offer to their community. And I'll say sometimes we do not have great turnout, but it's high quality. It's like high quality experience. And so we have not been gauging the success of the parent cafes we've done on numbers as much as the feedback we get from the people who attend. And so there'd be no pressure to ensure that a certain percentage showed up or anything. But the nice thing about it is it does have just kind of some structure, someplace, and a good, very good track record for creating a safe space for people to have conversations. And again, it's not necessarily conversations that solve problems as much as it's giving people an opportunity to process and kind of think about their own solutions, or kind of move on the continuum, grow on the continuum, if that makes sense. So
Yeah, that sounds great. And, you know, frankly, I think it would be helpful to us to also understand, you know, any ground rules that are put in place for people who participate in these, because, you know, I can, you know, be guilty of dominating conversations or dominating, you know, time. So, you know, I do think that would be an invaluable resource for us to even maybe have you participate in one or two as we try to jumpstart something.
oh, for sure, for sure. I mean, there's definitely a process, and there's kind of a training, and we have typically in a face-to-face cafe, it'd be a room or a table host, and in the virtual, it's a room host that guards the agreements. And they do have definitely kind of ideas in place for how to make sure nobody dominates a conversation and things. So yeah.
So wonderful. This has been really a great session. I thank both of you for participating today, and thank everyone that's here. If we need to follow up, I have all your contact information. And so if anybody wants to send me an email or contact me to get additional information, we can do that. And as well as discuss possibly working with some collaboratives, maybe with Sandra, Senator Roberts, who's smiling over there because she does a lot of this. Maybe we could talk about doing some type of cafes or our own, you know, whatever, to put together something for our community. So again, I want to thank you all for participating, and thank you all for taking your time to spend with us this afternoon.
Yeah, thank you very much, Dr. Chism Buggs, and thank you, Becky. We really do appreciate your thoughts, and we hope to have you back soon.
Thank you for inviting.
Yeah.
Thank you for the invitation.
Thank you very much.
Okay.
Have a great day.
Bye.
Likewise.
All right.
Bye-bye.